Hello there. My name is Allison Porter, and I am a general surgeon at Skagit Valley Hospital, which is located in Mount Vernon in the state of Washington. And I'm going to be speaking here on the rural perspective on community general surgery. I have nothing to disclose. And when I think about rural surgery, I have to actually dig pretty deep because it was a very personal decision for me to seek out a practice in a rural place. I had to think about what is it that I really wanted in my life, and I want everyone that's listening to this to be thinking about these questions as well. I also had to think about why did I become a surgeon in the first place, and really why did I become a doctor in the first place? And those are very much at the root of how I chose my practice. I think that every surgeon is going to have a legacy, and the question is, what is it going to be? You are going to impact so many people in your life and in your career. And my choice to go into a rural practice had a lot to do with my choices as far as what that legacy was going to be for me. The truth is that rural areas really need general surgeons. The US population, we all know this, is growing, and there just isn't the same proportional growth in the number of graduating surgical residents. And a lot of residency graduates are subspecializing now, and we think it's about 80%. Now, I did do a fellowship myself, so I would have been counted in that 80%, I think, myself when I was graduating. Yet I still took a job in a rural area. So just subspecializing doesn't mean that you're not going to be a general surgeon or work in a rural area, but this is kind of some of the numbers that people are looking at. Surgeons in rural areas are aging, and patients in rural areas are often impoverished. And they have a really hard time sometimes getting to urban areas to seek care. One of the things that has also been studied is that surgical care in rural hospitals is cost effective and safe. Now, when I think about this talk, I was thinking, there's rural and then there's really rural, and it's a spectrum. The place where I work, there's 137 beds in the hospital, and I have a pretty small group, but we have a little bit of help from surgical hospitals. So my call is only 1 in 7. I live on a farm, which is about an hour from a major city, which I don't think is all that far. I have to refer out of the county at times, but I do have access most of the time to subspecialty care. I have a really broad practice, but a significant fraction of my elective practice is within my subspecialty. So it's pretty rural, but in some ways it's not so rural. Now, when I'm talking about that, you're thinking maybe, a critical access hospital where there's 25 or fewer beds. There may only be 1 or 2 surgeons that are ever covering it at any given time. And sometimes the closest tertiary care center is an entire day's drive away, or it might be across a mountain pass, or there might be some other geographic boundary, or if there's a storm, it can be hard to get some other place, and that can be really isolating. Sometimes there's no subspecialty care anywhere in a hospital or a county or anywhere nearby. And people that work in critical access hospitals will often have a more broad practice and maybe not have quite as many options for specialization. I wanted to talk a little bit about my own personal reasons for choosing a rural surgery job, because those choices are going to be different for every person. Now, this is a picture of Skagit County where I live in April. We have a beautiful tulip festival, and that's actually a picture of my partner's barn. So I feel very fortunate to live in a place that's just really lovely, and it's pretty even when it's not tulip festival. For me, in my career, patient care was a top priority. There's so many things that doctors and surgeons can do in their lives and in their careers. And I just knew that I wanted to take care of one person at a time, and that was enough for me. That was okay for me. I had done some research and had kind of wondered if I ever wanted to do something in public health where I impacted many, many people all at once. And I really just knew in my heart of hearts that one person at a time was what I wanted to do. For me, having supportive, smart, thoughtful partners of high quality character was imperative. And I have been very, very lucky to have that in my practice. And I think it's one of the reasons I love it so much. I had to be willing to forego certain types of prestige. So when you live in a tiny little town that nobody's ever heard of, and you go to a big conference and you kind of have to explain why you chose it, it's interesting and it's okay. But it's just kind of a way of life, and that's fine. For me, I kind of wanted to just stop climbing ladders when I got to the end of my training. I felt like I had spent year after year after year, going up one rung at a time every year. And I felt that at some point I just wanted to be able to work, take care of patients, have a family, have some hobbies, and not be constantly trying to look for what was the next thing ahead. I love the variety of general surgery, and working in a rural area really brings that. But I also feel very fortunate that I've had the opportunity to specialize too. So for me, like I said, 50% of my practice is bread and butter general surgery. And in my elective practice, at least 50% is benign foregut. So that for me was a huge part of why I chose the job that I did, and might factor into any, your own decisions as well. Man, one of the things I love about where I live is reverse sticker shock, where I go places and I realize, oh, I don't have to pay for parking. Wow, dinner's a lot cheaper here than it was in the city. A babysitter's a lot cheaper. Just everything is really nice when it costs a little bit less than you're used to. Materialism, I just found that in the city, things cost more. People have nicer stuff and they're willing to pay more for it. And I just wanted to get that out of my life and out of the life of my family as much as I could. I love the outdoors. There's great trail runs 5 minutes from my hospital and basically right out my front door where I live. Um, I was really tired of having my life constantly interrupted by traffic and events. Living in the city, I always felt like if I wanted to run errands, I had to wait or get them done before 11 in the morning, because then everything got too busy. It was no longer efficient. So I just don't have to do that anymore. In residency, I felt like, I could only take 1 week of vacation at a time. It sure would be nice to have 2 or 3 weeks at a time, because then you can see a lot more things. So that was a big factor for me in choosing my job. There's a lot of benefits of a rural practice that I want to speak to that weren't necessarily, things that I wanted in my job, but you might want to think about if it's something that you're considering. I've already mentioned the breadth of practice. There's a lot of independence, which kind of goes both ways. It can be isolating, but you can, do a lot of your own decision making. Very high quality of life. There can be a lot of satisfaction that's gained when you are taking care of people who are truly underserved, or you're in an area where, maybe a lot of people don't want to go. Tons of opportunities for leadership. There's so many committees in hospitals, and surgeons tend to be leaders. So they get asked to be on these committees. And so that's something that I've found in my job. It's very interesting to be the first surgeon that encounters patients, because you kind of have to figure out, what am I going to do? What am I comfortable doing? And it gives you the opportunity to select your cases and also choose, what needs to go elsewhere. You don't necessarily have to miss out on teaching or research. There are ways to incorporate that into a rural job as well. Sometimes it's probably a little more challenging than in an academic center, but it can happen if that's what you really want. And rural practice can be a lot of fun. Now, it's not without its challenges. So I kind of mentioned isolation as one of those things. Call burden is another. When there's fewer general surgeons, you might be taking call a lot more often than you might in the city. There can be limitations on personnel or equipment, and staying up to date can be a challenge. So I want to address some of these challenges because I think they can be addressed, but they are something that you definitely want to be thinking about. Finally, deciding what to care for and what to refer out is another challenge. It's fun and a challenge. With regards to isolation, so there was a study that showed that an ideal sort of critical mass for the numbers of surgeons at rural hospitals is 3. So, one surgeon plus their 2 partners. And I was not surprised to hear that, because if it's just you and one other person, then it can feel pretty tough if one person's gone, one person's on vacation, then, or if somebody gets sick, it can be very stressful. So I think that's a really valid number, and I think it's very much something to consider. Connecting with colleagues at other hospitals and attending smaller local meetings has been a way for me to feel less isolated, even though I live kind of out in the country. With regards to call burden, knowing what your frequency is in your contract is very important, and also knowing what the medical staff bylaws are at your hospital, because those may be 2 totally different things. You also want to know what's going to happen if no general surgeon is available, because that's a possibility. If it's just you and one other person, somebody gets sick and the other person gets hurt, if that happens, if you're looking for a job, you're going to want to ask, what happens when there's nobody. With regards to limitations on personnel or equipment, these are things that can be figured out. You sometimes have to just be willing to make compromises. If you can't get, the hernia mesh that you want, you might have to pick or choose a different one. Sometimes equipment can be rented even if you can't purchase it. And as a surgeon, like I mentioned before, if you're involved in an administrative committee, sometimes you can be one of those people that helps to pick and choose what's happening with staffing and what's happening with equipment. That can kind of help move your practice along. Staying up to date, I think, can be a little bit more of a challenge when you don't have kind of a dedicated grand rounds or dedicated teaching sessions like you might at an academic center. It's important for every surgeon to have a personal commitment to reading and learning. I've found that attending conferences and dedicating time and funding to CME, and not every hospital is going to provide the same amount of funding. It might be something that you have to do out of your own pocket, but is something that's extremely important to stay up to date. This question of, what do you care for and what do you refer out? It's constant, it's ever present, and it's constantly changing. It's affected by your own skill set, but it's even more affected by what the resources are at your hospital, what the patient characteristics are, and even geography. How far away do people live? I have patients that live on islands, and so I have to really think about, when I'm discharging them, where are they actually going to go? So you have to kind of think about what are you going to take care of and what would be best taken care of elsewhere. Sometimes you just can't mitigate those challenges. Sometimes you just have to take care of patients because they're there and they can't get it elsewhere. Now, this is true for just about any hospital, but it's something that for sure happens in a rural setting. One thing I have found interesting is when we get a patient who has had a pretty complex hospital or operation at a larger hospital, and then they show up at our hospital with a complication, we get to take care of it. So that's something that happens and kind of just keep some spice in our lives. You really have to have a willingness to learn, change, and do the best with what you have. That's not unique to your rural surgery at all. I think that's pretty much part of just being a doctor and being a surgeon. In conclusion, I want everyone, again, like I said, who listens to this talk to be thinking about what are your priorities in your life and in your career. You are going to have a legacy, and the question is, what do you want it to be? Who are you going to interact with, and where is that legacy going to land? The degree to which a job is rural is definitely on a spectrum. A job at a large hospital in a rural setting is going to be different than a job when you're a solo surgeon at a critical access hospital. So it's not like there's just one type of rural out there. And what I have found is that many of the benefits of an urban or an academic job can be achieved in a rural setting. It just kind of depends. A career in rural surgery can be very fun. It can be very rewarding, and you can have a very high quality of life. So I think it's pretty great. These are my references, and thank you very much.